Hi, this is Jaswinder Sandhu, and I'm going to do the blood transfusion skill today. I have a patient, Mr. John Smith, who came to the hospital with the GI bleed, and his hemoglobin today is 68. And doctor has ordered to transfuse 1 unit of PRBC over 4 hours. And to start the skill, first step I'll do is gathering the supplies, and then I will check my orders from the chart, and blood work from the Meditech, and blood product itself, and the pink slip with the second nurse. And then I'll go at the bedside with the second nurse to check the identification of my patient. And then I'll start the transfusion of the blood. And then finally I'll do my documentation, make sure it's done properly. And then I'm doing it this like a skill in this sequence, just to make sure that I do start my blood transfusion within the 30 minutes of its arrival from the lab. Thank you. To start my blood transfusion, I need 2 bags of normal saline, one pump infusion set for the independent line, and then the other one is a BD pump infusion blood set line, and it's gonna be a micron filter tubing. And then I need some alcohol swabs, and then blood itself, and then for sure I need a BD Alaris infusion pump. Thank you. Hi, this is Jessie, one of the nurses working on the unit, and I have a patient whose name is John Smith, who is 70-year-old male, came with GI bleed, and then his hemoglobin has dropped to 68 from 76 today, and doctor has ordered the blood transfusion order, like it's 1 unit of PRBC, that's a packed red blood cells, to transfuse over 4 hours. And there's also order written like to do the cross match and issue 1 unit of PRBC, and then another order is to recheck the CBC tomorrow morning. So to start to transfuse, as my unit clerk has told me that the orders has been processed, it has been ordered entered in the Meditech, and the unit of blood, like the PRBC, has been issued by the TML, and then it's already arrived in the unit. So I have to kind of be quick for checking identification and for the blood and for the patient to transfuse within 30 minutes. Start the transfusion within 30 minutes, because otherwise blood product can go bad. So for that, I to check the identification and like blood, I want to make sure that I have a right patient and the right product to administer to avoid the error. So I need another nurse to double check with me to before we proceed with the transfusion. So I have I open the chart, I have a Meditech open, and I have a blood product with me. So I want to make sure that everything is right. So I have a patient. First I will start with the chart is for John Smith, and first thing I'm going to check is the consent for the transfusion. So it's been signed by doctor and the patient today. This is October the 12th 2024 today, and then it's signed, so it's good to go. Chandan is double checking with me that today's date is the 12th of October 2024, and the patient name is John Smith. Yeah. So then next I proceeded to the orders, where I'm going to double check that I have right orders. So patient name is again John Smith, and date of birth is 12th of October 1954, and the unit number is AB00123456. Patient has no non-drug allergies, and then the order is order is cross match 1 unit of PRBC, transfuse 1 unit of PRBC over 4 hours, and then repeat the CBC tomorrow again. So it's been transcribed to the MAR as I see it here. It's today's MAR October 12, 2024, and then it says transfuse 1 unit of PRBC over 4 hours. And then I have a record to write down for the record of blood component or plasma protein product administration record, in case we need it for the future. So I'm gonna open them, and my Meditech is open as well, and then I and Chandanpreet we're gonna double check it's the right patient and why we're giving it. And I have my blood here, and then I have my pink slip as well. So we'll go through the checking procedure. So as I read it for my patient name is John Smith.
Yeah.
John Smith.
Yeah, perfect.
And date of birth is 12/10/1954.
Yeah, it's 12 October 1954.
And the unit number is AB00123456.
Exactly.
And there's no non-allergies, as we know that. And then his hemoglobin is 68. That's why we are transfusing him. And his blood group now, I'm gonna check. It's a O, and it's O, and RH factor is a positive, and it's a positive. Now I'm going to proceed to the blood serial number. So Chandan, I will read it first, the whole number, and then you read it for me loudly as well. So it's W043017029897T.
Yeah, it's W043017029897T.
Yes. Yeah, so we have checked, and again I'm just checking on the blood itself, like it's O positive, and the expiry date is today by the end of the day, October the 12th, 2024, and it's by midnight the expiry date for the blood product, and again it's packed red blood cells, and the amount is at 300 ml. Its total is at 300 ml. So I'm gonna write it down on the record. So where I put the today's date, time. We're gonna start at, like right now it's 17:10, and I'm gonna start at around 17:20. And our component is packed red blood cells. Our serial number is W043017029897T. And it's checked by Chandanpreet, who's a secondary checker with me. She needs initials, and I just initial myself as well. And I'll put the exact time of the administration. So this is done, and now we're gonna proceed to. I'm checking these things as we just want to make sure that it's everything is accurate, and we're transfusing the right product, like right blood product to the right patient. So now after this we're gonna proceed to the patient bedside, and as I have already prepared my bedside like IV pump, and I'm gonna set up check the baseline vitals for my patient as I go to the patient, and we're gonna identify the patient as well. So that'll be my next task. Thank you. Hi, this is Jessie. I'm one of the nurse. I'm here to identify my patient, John Smith, who I'm gonna transfuse one unit of packed red blood cells, and I want to make sure that it's the right patient. I'm transfusing the right blood product. So to avoid the error for I want to double check, and I have my other co-worker Chandan with me, who we're gonna double check the identification for this patient. And here we come. Hi, Mr. Smith.
Hello.
Hi, we are here to transfuse the blood to you. So I want to make sure that you're a right person, and we are transfusing the right product to you. Could you spell your name for me, please?
Smith, last name?
Can you spell it, please?
Smith.
And your first name, please?
First name John.
Can you spell it, please?
John.
And what's your date of birth, please?
It's October 12, 1954.
Yeah. Good. And okay, so Chandan, his unit number is, I'm gonna check it against his ID band. Unit number is AB00123456. So I am checking it with the sticker written on our pink slip, and patient's ID band, and on from our copy of MAR. So I'm double checking. So now as we checked it with him, Mr. Smith, do you have any pain?
No.
Do you have any like anxiety, restlessness? Do you feel any like abnormal sensation or so at this moment?
No.
Okay, so so we have done the double checking with the patient. So now I'm gonna check his blood pressure and his heart rate and other vitals to set a baseline to start like transfusion for the PRBCs. Okay, thank you. I'm doing basically on the there right now. I'm just gonna start the blood itself because we have done already the checks for the identification for the blood product at the computer and at the bedside with the other nurse. So right now I'm gonna work with the blood. So I already prepared the my pump. So I have a normal saline line, independent one. In case the blood transfusion reaction happen, I immediately can switch it to the normal saline once stopping the blood transfusion. So I have blood hooked up here. I have done already the checks. So right now I'm gonna spike it, and then I make sure, first of all, I make sure the both lines are clamped, and then I'm gonna spike on this side, and I make sure I don't puncture it, and here it is, and then I'm gonna unclamp it to prime it. Yeah, yeah, it's coming through. I'll open from the port here. Okay, and I'm just gonna, as it was primed with the normal saline, so I'll make sure I'll prime it quickly because we have limited time to transfuse the blood, like within the 30 minutes of the arrival. So I'm gonna prime it. Yeah, it's coming down. I have already taken the set of the vitals for the patient, and they are good. His temperature is fine, and the patient is not complaining of any pain, discomfort, and no complaint of nausea or vomiting. So patient know the reason for the blood transfusion. He knows that his hemoglobin is low today. It's 68. Because originally he came to the hospital with the GI bleed, which has stopped, but his hemoglobin dropped to 68 today. So doctor ordered the 1 unit of PRBC over for 4 hours to transfuse. So that's why I'm here to transfuse the blood, and it's almost primed. I'll make sure it's going down the against with the gravity, so it's quicker. So once it reach the port, I'm gonna stop it, and then I'm gonna load it to the pump. Almost there. It's the big tubing actually. And I will make sure at the same time, I'll make sure there's no bubble or kinks in the line. Okay, so I'm gonna clamp the line now because it had gone there, and then now I'm gonna load it. And make sure it's loaded properly. And then I'm gonna, I already saline locked the line, so I flushed it the normal saline, and now I'm gonna hook it line up, and then open the clamp, and then I'm gonna start. So basically I can go for the guard IV fluids, and then I go to the blood. Once I click on the B, and then I go to here is the red blood cells, yes, and then the rate here, the rate is the main concern here. So I'm gonna start the initial rate with the 50 cc for first 15 minutes, and then after that I'll advance it if everything goes well. So total volume is 300 ml. Now I'm gonna start. I should make sure I unclamp it. I unclamp the blood side. So here it is. So I start going. At the same time I'll okay, and then now I'm gonna make sure I stay with the patient for next 5 minutes to see if there's any sign of a reaction or any change in patient status. So I ask my patient if he has any pain, he's complaining of shortness of breath, if he has any headache, any back pain, if he has a nausea or vomiting, or he's feeling restless, and same time I look for any rashes, pruritus, any flushing on the face, and any change in his breathing pattern, or so because those signs and symptoms I'm looking for, because there could be reactions such as hemolytic reaction, or it can be non-hemolytic febrile reaction where the temperature can be more than 38 degrees, or rise in the temperature by 1 degree from the baseline. And then it can be like anaphylactic shock, there can be a septic shock, or it can be transfusion related acute lung injury, or there can be circulatory overload. So once in 5 minutes I check, after 15 minutes I check the vitals. The vitals are all good, and then I'll give the call bell to the patient and ask him to give a call if there's any change, and then I'll come back and forth and check on the patient and make sure I'll change the rate to the 75 cc as blood. The transfusion going to happen over 4 hours. It's a 300 cc, so my rate would be 75 cc per hour, and then I'll be rechecking the blood pressure and all the vitals every hours. And once the blood transfusion is over, I will unhook the bag and I'll discard it in the biohazard, and then I'll make sure the vitals are charted, and then I take the pink slip, send it to the TML after filling it for no reaction happen. In case the reaction happens immediately, I'll stop the blood transfusion and I'll start the normal saline. I'll pack the remaining blood and send it to the lab. I'll check the vitals. I'll call the doctors and update about the patient's situation, and then follow the doctors afterwards, and then keep an eye on the patient status. And then in case no reaction happens, repeat blood work will be tomorrow morning for CBC. Thank you. So as the blood transfusion is completed, there has been no reaction. Patient is doing good. There's no change in the baseline vitals, and I still be keep monitoring patient. And then I just want to make sure that I did my charting. I have completed my administration blood administration record sheet. Then I didn't need to fill the transfusion reaction report. The vital sheet is completed, and I just want to make sure I do the final charting on nurse's notes. And I'm gonna sign the pink slip, and I'll send it to the TML. Thank you. Bye.